I'm Dr. Mendel's interpreter for today. What we've decided to do is for me just to read his paper to make sure that we manage to fit in these 10 minutes. If that's all our time, so we are quite ready to proceed. Okay. So, dear colleagues, since 1993 we've been developing a new alternative technology that combines local, conservative and surgical burn treatments. Joseph Lister was the first to propose that keeping the wound in a moist environment would facilitate effective healing. I think we are hurrying with the slides a bit too forward. No? Sorry, trying to go back. It's not getting back. It does. Fantastic. Sorry. Anyway, that was about Joseph Lister, who was the first to propose that keeping the wound in a moist environment would facilitate effective healing rates. And between 1960 and 1963, through various experiments, such gentlemen as Winter, Maybach, and Breitman confirmed Lister's idea. And here we present a retrospective analysis and evaluation of 786 patients. Boiling water burns and flame burns were the most common case, and 25 children experienced burns on more than 50% of their body surface. Own liquid medium, or OLM, is formed on the surface of the burn, of the wound, and it's formed directly under the plastic film dressings. This is in fact the wound exudate. It washes, drains, and stimulates the autolysis of necrotic tissue. Then a fibrin leukocyte membrane is formed on the surface of the burn wound, where it functions as a biological skin graft. It creates a healthy environment for cell growth and stimulates growth of granulation tissue in the wound. In order to carry out the OLM, the own liquid medium process, so-called M dressings are used to facilitate this process. They are semi-sealed adhesives where the inner layer is coated in a dry antimicrobial mixture. A healing of burns in the OLM in these groups occurs during spontaneous epithelialization, mostly without formation of pathological scars. And here are a few examples. So we can see the treatment process using only OLM. And another example, a child, 20, well, you can say anyway. And another example. Okay. Right, so out of our 786 patients, we were able to fully restore the skin surface of 626 patients using exclusively our own medium method without any surgery, and which totaled 80.3% of our patients. 181 children had burns of the 3rd and 2nd degrees of smaller size. Finally, here's a diagram of how through surgery we resect the pathological layers of granulation tissue above the fibrous layer. And this is done so that we may successfully apply the autograft. Right, and for the resection of granulation, we use dermatomy that allows us to regulate the removal of tissue of required depth. The perforator produces autografts with skin bridges inside the cells. This improves the healing of wounds in autograft cells and ensures a significantly better cosmetic result. A clinical example of surgical results, pre-transplant resection of the superficial layer of granulation tissue plus ADP. We can see a complete fusion of autograft without any pathological scars. So that was the moist environment that you've just seen. So in deep third-degree burns, we begin with subtotal necrosectomy surgery, and then we proceed to our OLM treatment. After OLM, we advance to pre-transplant resection of granulation tissue with autodermoplastic. Finally, we treat the autografts with OLM, which creates an environment necessary for regeneration. So what we're going to see the examples of subtotal necrosectomy and another example of subtotal necrosectomy. And the results, finally, out of 786 patients, we were able to treat 154 patients with our OLM method and surgery, which totaled 19.7% of patients. Through implementation of our own technology, we have successfully treated the burns of over 1,500 patients, and the majority of them were children. Thank you.
Thank you for your presentation. I would like to know what's the infection rate using OLM?
Is that the infection rate?
No, если она есть, она не высокая.
Well, even if there is any, it's not high.
Any questions? Please come to the microphone.
Right.
Excellent presentation. Road from Leicester. I just want to know, with partial thickness burns, you get the OLM production, right? Okay, but what do you do? It wasn't very clear. The full thickness burns after debridement, you put the skin graft and then cover with OLM again?
Indeed, so it's covered again.
Right. With full thickness burns, since all the dermis is gone, how is OLM produced and where is it produced from? And how do you get that amount to cover the grafts?
Да, когда закрываешь пластиковой этой повязкой,
So when the burn is covered with this plastic
его
dressing,
держит. Эксудат. Это раневой эксудат.
This burn exudate starts appearing, and this is the OLM base, basically. So the trick is to cover the burn with this plastic film.
Right.
So it appears.
Очистка, смена происходит через 24-48 часов.
And then we change plastic films in 24 and then in 48 hours.
Thank you for your presentation.
Thank you.
I'd like to make a change in the next presentation in that